Day to you. I'm Leona Poon from the Department of Obstetrics and Gynecology at the Chinese University of Hong Kong. Welcome to our educational series on the various components of the first trimester preeclampsia screening program. In this short video, I will share with you the standardized protocol using the sagittal approach for the measurement of uterine artery pulsatility index, which is one of the most promising screening tests for preeclampsia, especially for early onset preeclampsia requiring preterm delivery. The observation of abnormal uteroplacental flow velocity waveforms as a result of persistent high impedance to flow in the uterine arteries constitutes indirect evidence of abnormal placentation. I will also share with you an alternative method using the transverse approach for the measurement of uterine artery pulsatility index. This alternative method can be used if you encounter difficulty with the sagittal approach, but I do not recommend using the transverse approach in replacement of the sagittal approach. For the measurement of uterine artery pulsatility index by transabdominal ultrasound, with the transducer being placed longitudinally over the suprapubic area, a sagittal section of the uterus is obtained, and the cervical canal and the internal cervical os are identified. Subsequently, fixing the transducer in the midline, slowly and gently tilt it to the side, and color flow mapping is used to identify each uterine artery along the side of the cervix and the uterus at the level of the internal os. Pulsed wave Doppler is used with a sampling gate at 2 mm to cover the whole vessel, and care is taken to ensure that the angle of inclination is less than 30 degrees. When 3 similar consecutive waveforms are obtained, the uterine artery pulsatility index is measured from the left and right arteries. The assessment of uterine artery pulsatility index should be carried out by sonographers who have received the appropriate certificate of competence in the 11 to 13 week scan and Doppler of the Fetal Medicine Foundation. So the first step is to place the probe longitudinally over the suprapubic area. You can then see the uterus and the cervix. Fixing the probe in the midline. Then you can turn on color flow mapping. You gently tilt the probe to one side of the cervix. Then you'll be able to see the uterine artery appearing at the level of internal os. Once you see 3 consecutive waveforms that are similar, then you can freeze the image. Then you can use the automatic function to measure the uterine artery pulsatility index. And here you can see the values of peak systolic velocity being greater than 60 centimeters per second. And then you can see the pulsatility index of 1.94, which is within normal range. Once you have measured one side, you can go back to the midline of the cervix, turn on color flow mapping, then you gently tilt the probe and again you can use pulse wave Doppler and pressing the left button. Once you have 3 consecutive waveforms that are similar, you freeze the image and use the automatic function to measure the pulsatility index. And you can see that the peak systolic velocity is greater than 60 centimeters per second and the pulsatility index is 1.31. So the next method is with the approach of transverse section of the cervix. With the same principle, we place the probe longitudinally over the suprapubic area. You visualize the cervix and making sure that the cervix is in the middle of the screen. Then you rotate the image 90 degrees to visualize the transverse section of the cervix. So through the transverse approach, now you turn on color flow mapping. You'll be able to visualize both uterine arteries at the level of the internal os. So this is the right artery and this is the left artery. Now we measure the right uterine artery. And once you see 3 consecutive waveforms that are similar, we freeze the image and you use automatic function to measure the pulsatility index. So now we measure the left uterine artery pulsatility index. We use automatic function to measure the pulsatility index.